Primarily, I treat foot and ankle surgical problems, primarily orthopedic problems, so joint pain related to the foot or ankle, tendon problems, arthritis, and traumatic injuries, so fractures and tendon sprains or tendon ruptures. I always try to think of what is it that I would want if it were, myself or a family member that had to have this particular problem treated. And so, most of our typical visits, we'll probably see a patient at least 10 to 12 times before we even think about doing surgery, and there are many post-op visits after that as well. So we get to know them pretty well. I encourage second opinions all the time and try to really speak to the patient kind of more on a personal level. It's an exciting time to be in this field. It's really rewarding to be able to, like I said, restore function and mobility to patients and to keep them moving, which is really important. That's something that I've always been interested in, is the technicality of that, the detailed and the artistic side of medicine and surgery that a lot of people don't really appreciate. I grew up in Vancouver, BC, so most of my life was spent as a Canadian before I moved to the US to study and go through residency, and now here working in Seattle. Actually, before medicine, most of what I did was primarily on the art side. I played a lot of music, I did a lot of recording, and now currently I do some photography. So pretty much when I'm not doing medicine, a lot of it is more arts. Generally, our success rates kind of speak for themselves, and I tell patients that most people do really well, and for most of the things we treat, it's 85 to 95 percentile, and that's reassuring.